Today, I'm at Smitty International Children's Hospital, Thailand's leading private pediatric hospital, committed to innovation and world-class care. Smitty is expanding its services to become a top pediatric hub in the Asia Pacific, providing advanced treatments and expert care for young patients and their families. Sawasdeeคุณหมอ
สวัสดีค่ะ
Thank you so much for giving us some time to talk.
And thank you very much for coming to visit our hospital.
Okay, I would love to see all your hospital. So, shall we go?
Yes, please.
Welcome to A Time to Talk with me, Black People, and here she is, the very kind doctor, the Deputy CEO of Smitty and BNH Hospital, and also the Director of Smitty International Children's Hospital, Dr. Surangkana Techapaitoon. สวัสดีครับคุณหมอมีครับ
สวัสดีค่ะ
A great pleasure to have you on our show.
Thank you very much as well. Let me join the time to talk.
First of all, I would like to ask whether this building is very new, isn't it?
We just opened last month and we will have the grand opening on 5th of March.
Wow, it's very new and it looks very
Thank you.
comfortable and amazing. So congratulations.
Thank you very much.
Could you please share us your visions about this hospital?
Our vision, we align to the vision of the Smitty Group. We would like to be the agile organization of value. So I would focus on the word value to ensure the healthier future for every child. This is our vision. We have experience for taking care of children for more than 20 years. It means that the whole journey of care, from the cell care, early care, sick care, it means that what happened in the hospitals and the post care. For this journey of cell care, it means that we provide the knowledge and we help the parents can take care of their child health. And for the early care is the prevention, the health promotions. We can do the early detections, like the screening before the disease appear, or vaccination to prevent the disease. And the sick care is mean the treatment that we can do the complex care, the complicated case, and the post care is mean the rehabilitations and the home care. So we can take care for the whole journey of care.
Could you please share us about a milestone or recognitions that brings the hospital to the global starting point?
As you know that right now the number of the newborn baby in Thailand decreased quite a lot. Last year dropped to less than 500,000. So I think that parents would like to do the best thing, need the best care for their child. And it's not only in Thailand but for all over the world. So our aim for Smitty, we would like to be a leading of the pediatric referral in the Asia Pacific region. We use the word of center of excellence.
Center of excellence.
We set the center of excellence, but in some specific area, such as the pediatric oncology for the cancers and bone marrow transplant, or pediatric surgery, emergency and critical care, child development and pediatric rehabilitation. This is our milestone to be the center of excellence. We have the experience of taking care of the patients from international for more than 100 countries that come refer to take care of in our children's hospitals.
Wow.
We take care of more than 330,000 of children per year.
From all around the region.
All around the regions. This includes 7,000 of the critical ill and more than 1,000 of surgery that have done here. We take care of both the pre-care and post-care. We can use the technology telemedicine to take care for pre and post-care as well.
That tells a lot about the reputation, the trustworthy, the credibility of the Smitty Children's Hospital. Talk about repetition, recognitions. So I have heard that the hospital received some awards.
We receive the award such as the Best Children's Hospitals from Middle East Healthcare Leadership Awards. And another one is the Pediatric Service Provider of the Year
Okay.
from the Healthcare Asia Award.
Wow.
So we're proud to say that we have recognized from international.
Okay, that's a reward
organization.
from the global stage.
Yeah.
Could you please be more a little specific? So, in which country that the children decided to came here to Thailand to your hospital?
From ASEAN countries,
Yes.
like a country nearby, such as
Okay.
like Cambodia, Myanmar, Indonesia,
Okay.
And from the Arabic country, the Gulf country, like UAE, Oman, Qatar, and also the South Asia as well from Bangladesh. We set up the Center of Excellence because of this is a need, it's like a demand of the patients, and it like an opportunity that match with our strength. It's about for the excellence. It's not only for the clinical, but it's like for all angles. So why they come to our hospital? For our strategy, we use that 5-pointed star, like a star that is a 5-pointed. The first one is about the clinical. The second one about the people excellence. The third one is about the service excellence. The fourth one is innovation excellence.
Okay.
And the fifth one is about the financial excellence in the market excellence.
Okay. 5 angles.
5 angles.
Okay, combine into
Combined
one star.
to one star.
Okay.
And in the middle, we call the words in trust. Why they
trust
choose,
us.
they trust us. Our clinical excellence. I talk about the center of excellence. It's about the outcome of the treatment. So why they choose us? Because of outcome of excellence. When we do the transplantations, the outcome is about the success rate, about the 1-year survival rate, 5-year survival rate. All of the outcome, we meet the global standard. Like for 1-year survival rate of our bone marrow transplantation is 92%.
Wow.
92%. Global standard is between 85 to 93%. So we meet the global standard in the upper range. It's about clinical, it's about the outcome of the treatment because it comes from the people. You should have the people excellence. So we invest in training, we invest in developing our people. And people is not only doctors, but the team. Because we use a multidisciplinary team approach because it is a team. The doctors, nurses, the medical personnel to be experienced, we training them, and we do the collaboration with the Don-Baker Children's Hospital, Oregon Health and Science University in US.
Okay, in States.
In States and in Takasuki Hospital in
Japan.
In Japan, that we can share knowledge, share the experience together to develop our people.
Okay.
This is the second aspect. Yeah.
Okay.
And the third aspect is about service. We provide a service. We know that people from other countries, so we concern about the cultural sensitive, and we use the word empathic care, and with Thai hospitality. And I'm proud to say that we have done a survey for Net Promoter Score and customer satisfaction score. Both are more than 95%.
So another
one is innovation. It's innovation because of right now there's the modernized the way of treatment, the innovation of the treatment, the best thing for our patients. Best equipment, best technology, like for the bone marrow transplant, like a traditional one that need matching from father and from the donor and recipient. But right now we can do only half match, 50%. So you can have the donor from father or mothers. So half match we can do. So it's difficult one. But in the future, there will be we call the gene therapy and the cell therapy, like a CAR T cell for treatment of the cancers and gene therapy for treatment of the thalassemia. Which we plan to move. We will have the CAR T cell this year, but gene therapy in the next few years. But we wait for the Thai FDA to approve. This is mean that for the innovations. And the fifth one is about we call it financials, but it means the market. So we have many people from like other country come to treat in Thailand. And for children in our children's hospital, 40% are foreigner, half are expatriate here, and half fly in like a medical tourism to Thailand. We try to relate to the word value. We create a value thing for our patients and family.
You were to come, you were to pay.
And every angle, like working together to the central, the wording of trust. We would like to gain trust from our parents and the families and patients.
And those are the strategies that you try to implement and still implementing every day to expand your reputation globally. And how about the pediatric care, do you have like more expertise through specialties or any special departments that distinguish your hospital to the others in these regions?
We call the pediatric oncology, pediatric cancers, and
Pediatric
stem cell transplantations. I'm proud to say that we are the leading of the stem cell transplant in ASEAN.
Wow.
Compare between private hospital. I think we are the first in the first
Number
rank.
one.
Number one.
You can say that, number one.
Yeah.
So why you're so confident that you are number one?
For the number of the patients,
Okay, and the success rate.
as well. Because of if you have done only 2 successes, it's not. We've done hundreds. So for hundreds and with the success rate and with the global standard. And as well, we have referral cases from other country for this kind of treatment.
So if we talk about the medical specialties, the one thing that you are proud of,
And
oncology.
Oncology.
Okay, cancer.
Cancer and
children.
In children. And another area is about the critical care for the newborn, for the newborn baby. And we can take care of the very small newborn baby. Right now, we can take care less than 500 grams. The small one, the tiny one.
When they were delivered too fast. Right,
Yes.
like 7 months, something like that.
Less than that. It's 22, 23 weeks. It's allowed 5 plus
They
months
still survive. Wow.
We can take care because with the team, it's not only neonatologists, but the team of expertise in take care of the small baby.
Okay.
We call the PICU, Pediatric Intensive Care Unit.
Okay.
We have the like a pediatric intensivists who are rare in Thailand, and with the team that we can take care of the like a critical ill, seriously ill children. We can do the ECMO because sometimes heart and lung do not work.
Okay.
And we use this kind of treatment and wait for until the heart and lung of the patients come like better. We can do this ECMO, extracorporeal membrane oxygenation, since the newborn and small children.
Okay.
So we save many children.
So you have so many specialties that can take care of like the newborn and the very young children.
Yeah. To be the center of excellence is not only for the physical part. When we take care of the child, we call the word holistic care. Holistic is mean that for not only the physical, but for the mental or psychological and developmental. We have the center called Child Development and Learning Enhancing Center. We can do the assessment for their development and can like enhance their development. And also for the psychological part, for emotional problems. We have the big team for the doctors, for the child development, pediatricians, child psychiatrists, and psychologists.
Okay.
We have art therapists, music therapists, speech therapists, and like many more like to take care of the child. We have the program to take care of the of this program. Another area that I would like to focus, we call the child life program. When the child or children come to like stay in the hospital, that sometimes they feel like not secure, feel anxious,
depressed.
Yes, we have the team we call the child life program to help them to pass this period when they have the serious case, critical in the PICU, or they need some investigations that like make them fear.
We have the specialties in terms of taking care of child's mind, child's mentality. Okay, wow, that's good. Could you please share a little more about the most challenging case that you have ever cared?
I will share you about our another area of expertise, aeromedical transportations.
Aeromedical
transportations. It means that transport patients, evacuate or repatriate patients from one place to one place by airplane.
You mean helicopter?
Helicopter. And another one is about commercial flight. Aeromedical transportation need expertise because we need the aviation medicine, about the aviation medicines. We need team that understand what the physiology change when you go to like in the plane.
So you need a lot of calculation.
And our team here is specialized in caring children, for children and newborn. We are newborn evacuation. And our team is the instructor of the, we call National Institute for Emergency Medicine. We have the case last, I think, the end of last year with the mothers come from, there's a French woman with a family go to vacation in Cambodia from France, and they have 30 weeks of like a pregnancy and have the, like a premature like a contraction, premature labor.
Okay.
So our team of the obstetrician and OB, aviation medicine, the newborn
From Cambodia?
Cambodia to here. If the newborn mother gets labor in the plane, we can help them, but we can like take mothers, transfer them to here and have labor here. The newborn have the very serious about the lung and the brain. We do the surgery. We do the surgical surgery here. The baby is only 1.2 kilograms.
Wow. He or she's so small.
So small.
And the doctors can operate the
Yes,
surgery.
Surgery, yeah, here.
With the size of the baby.
Yeah. And we repatriate back to France.
Okay.
And for like aeromedical transportation, I have another case. This one is very serious one. You know the conjoined twin.
I know their body is like connected. Okay.
Conjoined
to
twin.
each other. Okay.
And premature as well is about one kilogram and have the heart disease.
Oh.
Had a heart disease,
goodness.
like a heart disease.
So they need so many operations at the same time.
And they would like to go to like this is from the public hospitals in
Okay.
Chumphon.
Okay. So this is Thai.
Thai
Okay.
to Surangkana hospitals.
Okay.
Because Sopachor asked us to help
Okay.
to like transfer this baby conjoined twin by helicopter. Small compartment.
Okay.
We need two baby. We
Okay.
need two team. But how can we do it in that area at that like a small space back to Bangkok?
And did they survive?
Survive and they can right now.
Wow.
Yeah,
So
they can separate.
They both survive.
Yeah.
And right now they were like
They-
disconnected
yeah.
already.
We do like a whole team of transportation because of if there are a serious case, they ask us
Okay.
to for
Okay.
many missions
They
in
were
this country.
transferred by your team,
Yeah.
but were operated by Chulalongkorn's doctor.
But we do the repatriation from many countries nearby, from Myanmar, from South China. So we have done, I think, for the Aeromedical transportation, nearly 500 cases, nearly 20, about 15 years.
And the success rate
It's-
is like nearly 100%. Wow. So I have to applaud you that. Thank you so much. Especially all the family must be grateful to you and your
Thank
hospital.
you.
Let's focus more about innovation. Since Smitty International Children's Hospital recognized as a smart hospital, so you have been using so many technologies such as AI, robots, and so on. Could you please enlighten us? So why they call you a smart hospital of Thailand?
I start with the like a medical equipment. We have like a modern medical equipment, but not only like for the medical equipment. There is another part like the digital, like our platform that called WellKit. It's called WellKit. WellKit.
Like an application?
Applications.
Okay.
Because of for adults we have the Well applications.
Okay.
So for children we have WellKit.
Okay.
It's KIDC. Like
KIDC, okay.
Yeah. For WellKit. This
Okay.
help like for connect with the parents. They can track the history of the children, about the vaccination history, the medication history, and can do the appointment online. So it's easy for the patients come to the hospitals, and also the fast pay.
Okay.
And that applications, algorithms that can help the parents for if they need help. We call it Kit Check.
The features
It's a
in
feature
the Kit
in the
app.
Kit app, a sign and symptom,
Okay.
and can analyze that it's an emergency or not.
Wow.
And if they need like first aid, give the recommendation for your first aid. And
Wow.
if you need to come to the hospital, there's a link to our like a dispatch centers,
Okay.
our ER and
Okay.
emergency room, connect
To
to
your
our specialist and
Okay.
to our like ambulance who can take care of the child. And also that like when you come to the hospital, we implement like we call the smart OPD. You can come to see the doctors for the medications, so we can decrease the time, the waiting time. We calculate that we can collect the waiting time to less than 60%.
So basically, if the parents of the kids patients use this app, So they can decrease
The
the
wait
time,
time
the
for-
waiting time to
yeah.
bring their kids to.
to the hospital,
To the hospital.
and for the
Okay.
waiting for the medicine and for payment as well.
Okay.
And for the IPD, we call it a smart IPD. And so we have the like a flow that can decrease the like admission time and discharge time. Sometimes the child stay with the like a baby sister, but they would like to know that what happened in the hospital. We have the connection with the parents called the Smitty prompt, so they can know that what happened in the hospitals. We have another system we call that like a remote IV alarm to the nurse station. So alarm the noise the sound. Go to the nurse station.
Okay, so the children wouldn't hear.
Yeah.
Wow, that's good. So this organization, your hospital, Children's Hospital, is run by data-driven policy already. Everything will be collected as information, as data to develop the good health and the more comfortable service to other patients.
It's not only happen in the hospital.
Okay.
We call the Smitty Virtual Hospital. It's a virtual hospital, telemedicine. We take care of the patients before they come to the hospital for the like a pre-hospital.
Okay.
Before they come to the hospital, we can do the consultation. For home care, we can use this telemedicine to follow up, to take care after the patient's going home.
If you were once a patient of this hospital and your symptom is not so severe, you don't have to come to the hospital. You just connect to other doctors or the medical service through application.
Yeah.
That's all. Wow.
Talk about the robot.
Don't tell me that you have like a robot doctor. Not yet.
Not yet.
Okay.
But we have kind of robot for like a rehabilitation. We have like a for robot for the gait training and for the lumbar, for helping for the for your leg with the children with the neurological disease, and they have like a weakness, and we help them to teach them how to walk again. The physiotherapist with the robot.
Okay. Just use them combined together. Anything else that you can think of that I'm so proud of this innovation that we are using.
The innovations. We'll talk about the surgery. We talk about the minimal invasive surgery. Minimal invasive means that a small incision. Here we have done a lot of open heart surgery for the congenital heart disease. Go into the heart, use the heart-lung machine. That means that stop heart to work. Children can survive by this machine because it's very difficult if the heart pumping and you do the surgery. We stop the heart for pumping. It's like the ECMO, but it's called a heart-lung machine. Right now, some like a condition, we can do the minimal invasive surgery for heart. We call the intervention cardiac catheterization. It means the treatment by cardiac cath. And another one is about the surgery of the brain for the brain.
The brain?
Sometimes it's very difficult to treat. It's called a drug-resistant epilepsy. Cannot control the epilepsy with medication or drugs. There is like a brain that creates the abnormal impulse. We remove it all to stop that impulse. So it's like an invasive. Right now, some kinds of epilepsy does not need this kind of invasive surgery. We have less invasive one. We call the vagus nerve stimulations. To control the convulsion, we put a device. This kind of device can go through the vagus nerve, send the impulse to the vagus nerve to the brain, and to stop the abnormal impulse in the brain. The device is on the chest wall, but they send the impulse via the nerve. Impulse via the nerve
then the
to the
impulse
brain.
will go through the small vessel,
The small nerve.
It's very small. Do you have like a exchange doctors program?
Yeah, we have exchange doctor program.
Next
month, the team from the state will come and we set up the course. We have the training course for the doctors and nurses here as well. And our team went over there and can learn. So we do the tele consultation, a telemedicine.
So you get some consult from states.
We can,
from the doctor there. Wow, that's good. That's good collaboration. Anything else about the strategy in terms of collaboration?
In my dream, the hospital here is not only the hospital.
Okay.
We would like to be the training center.
Training center.
In the future.
A young doctor from all around the world will come here to learn something new.
We can share, we can learn. Right now we do the like a exchange program with other hospital in this area in this area.
So
in
there will
ASEAN.
be like a big seminar. I hope you can succeed your dream anytime soon. Could we say that your organization is right now at the front row?
I think now Thailand is the hub for the medical tourism. We have we comply to the national policy. We have the patients from abroad, pediatric care for our children patients. Then in the area, they can come here for some special care, such as cancer, like a bone marrow transplantation, or some advanced treatment for the minimal invasive surgery.
So you give them service if they would like to come to Thailand for relaxed time and get their children for the good treatment. They can pick Thailand and then be more specific to your hospital.
It's aligned to our vision that we would like every children have a healthier future.
And anything else so you would like the government to do more to maybe promote or make the world know that Thailand is ready. We are ready to be like a medical hub of this region.
The government they have done many things for promoting. They set up the team and to talk to go to another country and ask the a private sector. Sometimes it's difficult for private sectors to go to visit the hospital in other country.
Okay.
But they help a lot. Okay. We need help from from the government as well to promote us in other country.
Okay.
Not only right now they promote in this ASEAN country, in the Gulf area, the Arabic country, but we need more, all around the world. There are many countries that do medical tourism as well. So we need more and more.
And we have capacity.
We have capacity.
We do have more rooms.
More rooms.
Yeah. Okay. To take care of them all.
Yeah. So we need if they can help us, to penetrate more and more countries.
Okay, I would like to ask you one last question first before we end the show. It's a question from the show. Okay, I'll ask everybody. If you, doctor, have to pick one biggest issue that you consider it is a seriously time to talk about it, so what would it be?
I would like to say that the health span is more important for the health. I'm a pediatrician.
Okay.
I would like to say that health start from the young one.
Okay.
And then from healthy children to healthy adult and to healthy senior elder.
Okay.
Yeah. As I told you, it's not only for physical health but holistic health as our a vision that we ensuring the healthier future for every child.
Because they are growing to be the healthy adult, healthy people.
Yeah.
Okay. Wow. That's good. Yeah. That's good issue. Thank you. Okay. That's about the questions of the show, and you answered this very well. Now it's about time to walk. Could you please take us on a tour to see the special room, any department at all?
I would like to show you. We call it hybrid OR. Hybrid OR, operating theater, operating room.
Okay.
That we have talked about the intervention, cardiac catheterization.
Okay. Are there any operations? Operating?
No, because if they have operations, we cannot go.
They won't allow us. Okay, let's go.
It's our hybrid operating room.
Oh, but he's massive. It's huge. And so why do we call it hybrid? Why?
Because of this hybrid, it means that it's the two things mixed together. So this is the diagnostic, the C-arm X-ray. We can do the diagnostic here.
Okay.
And also the treatment, they can do the operating here as well. We call the cath lab. cath lab for diagnosis and do the treatment for the a catheter that I said. But if sometimes we cannot cure by using the catheters, we can do the operation here.
Okay.
No need to move to the patients to the operation. We call the biplane cath lab. Biplane cath lab is a benefit for the children. You have C-arm, two C-arm, so they can make the image in multi-angle
in various dimensions
at the same time.
Okay.
So it's benefit for children. The children exposed to less radiations and less time. So it's good for children. So we use a biplane. It's not a single plane.
So this room is specifically designed for children patients.
For children patients.
Because the doctor might have to compete with the time and order inconvenience.
Yeah.
So the children can be X-ray through this machine and then operated on the surgery here.
If they can do interventions that use the catheters, we can do it here. But if we cannot, we can change this room to operating room. This is our control room. Because when the surgeon work here, they need the technician for the control or the machine over there.
This has been recorded.
For the cardiac catheterizations.
Okay. Her heart?
It's about her heart, do the catheterizations.
Okay. Wow, amazing. So, fundamentally, how many people in this room?
2 people in this room.
Okay. Okay. Thank you.
Thank you. ขอบคุณค่ะ
It's been a great day and a great honor to have you on our show. It's been a pleasant day and with all the knowledge and enjoyable talk. Thank you so much ครับคุณหมอสุรังคณา ขอบคุณครับ
You're welcome.
I wish I don't have to come to hospital that very often.
But stay healthy.
Okay, I'll try to stay healthy just like you said, and you take care as well. And for you, my beloved audience, don't forget to take care of yourself and the one that you love. Be a good health and good wealth. And until next time, let's see who will be our next guest on A Time to Talk and meet that people. See ya.